Hello everyone, this is Dr. Jawad. If you're watching this on YouTube, thank you for watching my channel. Please hit the subscribe button down below, and next to it is the bell notification. When you hit that, and when I upload my videos, which I try to do weekly, you'll be first to be notified. If you're watching on Facebook, thank you very much. Please hit the like button, like my page, and if you find this information valuable, please share with a friend. If you want a free consultation, you can go to my webpage, www.totalhealthdepage.com. There's a button on the upper right-hand corner saying Book Now. You could talk to me one-on-one for 15 minutes to see if I could help your case. Hope you enjoyed the video. Thanks for watching. Hello everyone, this is Dr. Jawad. In this short video, I'm going to answer a question that was emailed me, and that was, I'm on thyroid medication. I'm trying to take these supplements, I'm having a reaction, it seems that I'm overdoing it, I'm jittery, and also I'm trying to eat these foods that makes me even more jittery, and what should I do? Okay, so emailing her back, I understand that she's taking a thyroid medication, she wants to clean up her diet, and she wants to implement some supplementation. However, if you are on a thyroid medication, you're doing it because your thyroid is not working, okay? And the problem is when your thyroid's not working properly and you are on synthetic thyroid medication and you're trying to improve the thyroid gland naturally, you have to work with either a functional medicine specialist or your primary doc to say, okay, let's lower the dosage because I'm building something up. Because remember, when you're on the thyroid medication, it's because you're broken, okay? So they put you on medication. So when you're trying to make that system work again, it's because it was broken. So all it's going to do is vamp it up even more. Now the medication, there's two different types of medication that you're definitely going to be put on. It depends on what system they're going to be working with. Most common will be Thyroid, which is your levothyroxine, which is your T4, okay, artificial T4, and then Cytomel, which is T3. Now we make 80% of our thyroid hormones is inactive T4, which gets converted to active T3. So I'm just going to go over a little list of, again, if you're on these medications, and if you want to get off, either give me a call, visit my webpage, again, we could talk on the phone, or visit a functional medicine specialist, or talk to your primary doc and say, hey, what can I do to get off of this? Because I want to fix my diet. So the key ingredients, again, calcium, iron, and soy. Okay, now soy, I always say nobody in America should be on soy, period. It does a lot more damage than good. However, if you're on calcium and iron, that's needed for thyroid hormone. However, it decreases the absorption of the thyroid medication. So you want to watch that out. Now, supplement alpha lipoic acid. Alpha lipoic acid is phenomenal for the system to make work to generate energy. Okay, and that's another video altogether. However, by taking alpha lipoic acid, okay, it lowers the T3 levels. It lowers those active thyroid hormone, the hormone levels. In turn, what's going to happen is going to increase your thyroid stimulating hormones levels. Okay, so you want to err on the side of caution if you're going to try taking alpha lipoic acid. Next one, L-carnitine or acetyl L-carnitine. I've done videos on those, and it's phenomenal for the energy production system. However, it inhibits the activity of thyroid hormones. It slows down the thyroid if you're on thyroid medication. Okay, so one of the things that these two are good for is if you are hyperthyroid. Okay. Next, CALP supplements. CALP is phenomenal to activate the thyroid. If you're it's phenomenal. However, if you're on thyroid medication, it's going to boost your the TSH levels. And it's going to make your body produce more thyroid hormone. Iodine supplements. Iodine is amazing for the production of thyroid hormones. However, I always recommend if you have an iodine deficiency, only if you have an iodine deficiency, take iodine. If you're hyperthyroid, stay away from iodine and any type of iodine supplements, because all that's going to do is going to take your thyroid, the activity of your thyroid, and power boost it even more. Next, ashwagandha. I talk a lot about ashwagandha to my patients, to my students. I recommend it a lot. It's phenomenal for adrenal support. However, What ashwagandha may do may increase the levels of thyroid stimulating hormone levels. It's going to make it jittery. I've had patients of mine who didn't tell me that they're on thyroid medication, tell me that they're taking ashwagandha, and they're having a negative response to it. And then when I ask them, are you on thyroid medication? Yes, I am. Well, why didn't you tell me that? Well, I didn't think it was important. Okay. Next, resveratrol. Resveratrol is phenomenal when paired up with turmeric as an excellent anti-inflammatory, antioxidant, cleans the liver pathway. However, it may increase those TSH levels. You may get a negative response from taking resveratrol if you're on a thyroid medication because it's cleaning up the system. Remember, you're on the medications because you're broken. So we're trying to clean it up. Next, lithium. Lithium, it's for, I don't want to get into it for this video, however, long-term use of lithium may actually damage the function of the thyroid. So if you're on lithium, you may want to keep on getting your thyroid levels checked and talk with your primary doc or whoever put you on lithium. Next, foods. When I work with patients about improving their thyroid gland, I'm always looking at foods. Clean up the food, clean up the gut, clean up the gut pathway, clean up the liver pathway, okay? However, there are some foods that interfere with the bioavailability and the absorption of synthroid. And the foods are, one thing is, nobody should be on soybean. Soy, it's deadly, it's deadly, it's deadly. Dietary fiber, walnuts, grapefruit juice. Grapefruit juice will block the absorption and the bioavailability of any medication, supplements, and so forth. So if you like grapefruit juice, bless you, just make sure you take it in between. Don't take it with the supplements. Now the cruciferous vegetables, broccoli, Brussels sprouts, and cabbage, yes, phenomenal for the liver pathway, phenomenal to control estrogen levels, phenomenal for the body overall. However, raw broccoli, raw cabbage, raw Brussels sprouts will block the absorption and the bioavailability of many medications. So my recommendation is always cook them first. Don't fry them by any means, lightly steam them. Okay? Hope you enjoyed the video. I'll see you in the next one. Be good.